Hi everybody, and welcome to my poster presentation. I'll just start off with the title here is Improving Therapeutic Communication in Nursing Practice, and it's a literature review that I did. So it's been established a long time in the nursing community that therapeutic communication helps patients not only stay calm, but it helps them have better outcomes and feel more satisfied in their amount of care that they have. But over the years, there have been a lot of barriers that have arisen to having therapeutic communication. And that includes things like technology in the workplace. So my clinical question is, in the hospital setting, what is the effect of nurse training in therapeutic communication compared to no therapeutic communication training on positive patient outcomes in the hospital setting? And for my methods, I use search terms such as psychiatry, nursing, therapeutic communication, research, psychology, nursing training, nurse communication, and nurse communication interventions. And I use databases such as CNAL, Nursing Reference Center Plus, and PubMed. And what I came up with was some very interesting results. There have been a lot of studies about therapeutic communication and things that we can do to improve it. And I selected 5 of those articles. One was about the electronic health record and how it has become a barrier to therapeutic communication, because I think we've all seen those nurses that walk into the room, go straight to the computer, start typing away, don't even talk to the patient, maybe don't even look at the patient, but that has become a barrier. The training is needed to be able to help that nurse have that effective therapeutic communication with the patient. Next up is how the patient's perception of the nurse can affect therapeutic communication. If there's a difference in, socioeconomic status, maybe a language barrier, this all changes how the patient views the nurse in the scenario, and can be a barrier to effective communication. And other things such as religion play a role, and social classes and things like that. This article explains that how you can kind of use that perception to your advantage and change the way the patient sees you so that you can build that trusting therapeutic relationship. Another article spoke about the implementation and use of active listening in everyday contact with the patient that provides the opportunity to externalize their thoughts and concerns, and of course gives the impression that the face has a listener who watches him with attention and interest. This is such a huge thing for our patients because they need to know that you're there, that you're listening, and that you're willing to help, and that you care about them. And so that's another way we can effectively create better therapeutic communication. Well, I'm not going to talk about all of the articles that I selected. We're going to jump now to some of these conclusions. While studies on the implications of therapeutic communication versus no communication were not found, it's hard to find one that answered my clinical question specifically. I was able to find all of these articles that suggested ways to improve therapeutic communication. So the literature review provided information about barriers to proper therapeutic communication in the nurse field, such as using the electronic health record when in patient's room, socio-demographic differences between nurses and patients, and language and cultural differences. It can be concluded from this literature review that the importance of therapeutic interaction between nurses and patients is important for clinical outcomes and must be, something that's specifically trained on in the nursing field, whether that's through the nursing workplace or whether that's through a nursing school program. I had some help on this project from a friend of mine. It's actually my mother, Suzanne Burke Gunderson. She's an RN and had worked years and years in a psychiatric setting. One of the barriers to positive patient outcomes was that the nurses weren't willing to engage with the patient, and they weren't willing to spend time with them and to talk to them, which is such a huge thing in psychiatric care. Thanks for watching. Appreciate it. Hope you enjoyed my poster presentation.